Dr. Susan Hartley, voiceover men. When was the last time you gave real thought to your reproductive health? Not just function, but full wellness. It's not just about avoiding disease. It's about understanding your body, recognizing early warning signs, and living with confidence and vitality. In this video, we're diving into male genital health, anatomy, hygiene, aging, early warning signs, and what every man needs to know, but often never talks about. Why male genital health matters. Men's health is often overlooked until something goes wrong. But early prevention, awareness, and care can drastically improve quality of life, physically, emotionally, and sexually. It's about more than performance. It's about function, comfort, and longevity. In fact, your genital health can be an early warning sign of larger issues, like diabetes, hormone imbalance, or even cardiovascular disease. The male genital anatomy, a simple breakdown. Let's start with the basics. The male genital system includes the penis, responsible for urination and sexual function. The testicles, or testes, produce sperm and testosterone. The epididymis stores and matures sperm. The vas deferens transports sperm. The prostate gland and seminal vesicles contribute fluid to semen. The urethra carries urine and semen out of the body. Each part plays a critical role in fertility, hormone balance, and daily function. Normal versus abnormal. What to look for. Most men aren't taught what's normal and what's not. Here's what's considered normal: smooth, evenly colored skin, mild odor, no discharge, occasional mild itching or temperature-related changes, occasional changes in firmness or shape, if short-term. Now, here are red flags you should never ignore. Lumps or swelling in the testicles, persistent pain in the groin or scrotum, sores, rashes, or unusual skin changes, discharge, strong odor or pain during urination, erectile dysfunction or sudden changes in libido, hygiene and daily care tips. Good hygiene is one of the easiest ways to protect your genital health. Simple steps include: wash daily with warm water, no harsh soaps, wear breathable underwear, preferably cotton, avoid prolonged dampness, change after workouts, keep the area dry and cool, especially in warm climates. Check yourself regularly, know your body. A clean environment supports healthy skin, lowers infection risk, and improves overall comfort. Understanding erections. Morning wood. Erections are a normal and healthy part of male physiology. Morning erections, or morning wood, are signs of good blood flow and hormone health. If you stop getting morning erections regularly, it can signal low testosterone, poor circulation, diabetes or nerve damage, cardiovascular disease risk. It's not just about sex, it's about systemic health. Always report major changes to your doctor. Testicular health. The monthly self-check. Testicular cancer is most common in men ages 15-40, but it's highly treatable if caught early. Here's how to do a monthly testicular self-exam. After a warm shower, gently feel each testicle between your fingers. Look for smoothness, firmness, and uniform shape. Report any hard lumps, swelling, or sharp pain. This simple 30-second habit could save your life. Common male genital issues. Non-sexual. Not everything is an STD. Common non-sexual male genital conditions include jock itch, fungal infection, red rash in groin, balanitis, inflammation of the foreskin or head of the penis, phimosis, tight foreskin that can't be pulled back, in uncircumcised men, hydrocele, fluid-filled swelling in the scrotum, varicocele, enlarged veins around the testicle, like varicose veins. These are treatable, but they should be diagnosed early to avoid complications. The role of hormones, especially testosterone. Testosterone plays a major role in libido, muscle mass, energy levels, mood, sperm production. After age 30, levels decline by about 1% per year. Symptoms of low testosterone include low energy, depressed mood, reduced sexual desire, fat gain, muscle loss. If you experience these, ask your doctor for a hormone test. Treatment is available and safe under supervision. Closing. It's time to talk about men's health. Male genital health should never be taboo. Whether you're in your 30s, 50s, or 70s, understanding your body is a form of empowerment. In Part 2, we'll explore sexual health, aging changes, prostate issues, myths, and how to care for your body through every decade of life. How aging affects male sexual health. The truth about erectile dysfunction, the importance of prostate health, safe supplements and medical interventions, and how to maintain confidence and function for life. Let's continue your journey toward lifelong wellness. How aging affects male genital health. Aging changes everything, and that includes male reproductive health. Here's what to expect as the years go by. Testosterone decline begins around age 30. Blood flow slows, impacts erections and sensitivity. Stress sleep affect libido and performance, nerve response. Time increases. Erections may take longer. These changes are normal, but not always inevitable. With the right care, men can maintain function and enjoyment well into their 70s and beyond. Understanding erectile dysfunction, ED. Erectile dysfunction isn't just a bedroom issue. It's often a health signal. Common causes include poor blood circulation, diabetes, and high blood pressure, low testosterone, stress, anxiety, and depression. Smoking and alcohol overuse. If you experience occasional ED, it may be normal, but chronic ED needs attention. Why? Because it can be the first sign of cardiovascular disease. Boosting function naturally. You don't always need a pill. These natural strategies can improve performance. Eat a heart-healthy diet. Exercise regularly, especially cardio. Get 7 to 8 hours of sleep. Manage stress, meditation, yoga, or therapy. Quit smoking. It restricts blood flow. Limit alcohol. Too much can reduce testosterone. Many men see improvement in just weeks with lifestyle changes alone. Supplements, medical options. When natural steps aren't enough, medical help is available safely. Safe supplements to discuss with a doctor. L-arginine boosts nitric oxide for blood flow. Ginseng, studied for mild ED relief. Zinc, vitamin D, support hormone levels. Ashwagandha may help with stress and testosterone. Prescription options. PDE5 inhibitors, like Viagra or Cialis. Testosterone replacement therapy, TRT. Injections, vacuum pumps, or implants. In advanced cases, always consult a urologist or men's health specialist. Self-medicating is risky. Prostate health. Why it matters. Let's talk about the prostate gland, a small organ behind the bladder that helps produce semen. As men age, the prostate can enlarge. This is called BPH, benign prostatic hyperplasia. Symptoms include trouble starting urination, weak urine stream, incomplete bladder emptying, frequent nighttime urination. This is common, but manageable. However, always screen for prostate cancer, especially after age 50. Prostate cancer. What you must know. Prostate cancer is the second most common cancer in men. The good news? It's one of the most treatable if caught early. PSA blood test can detect prostate protein levels. Digital rectal exam, DRE, a quick, important screening. Start screenings at age 50, or earlier if you have a family history. Early detection can be the difference between full recovery and long-term complications. Protecting fertility. Even after age 40, many men wish to maintain fertility. Here's how to protect sperm health. Avoid heat exposure, hot tubs, laptops on lap. Avoid excessive alcohol and tobacco. Be cautious with testosterone therapy. It can reduce sperm count. Store sperm if undergoing chemo or certain medications. Eat antioxidant-rich foods like berries, spinach, and walnuts. A fertility checkup is quick and often covered by insurance. When to see a doctor, don't wait. Many men delay seeking help out of embarrassment or fear. But the earlier you act, the better the outcome. See a doctor if you notice changes in sexual function, pain or swelling in the testicles, urinary changes, unexplained fatigue, mood shifts, or weight gain. No morning erections for several weeks. You deserve answers and support. Final message: aging with confidence. Male genital health is not just a private matter, it's a life issue. It connects to heart health, mental health, self-esteem, and longevity. Talk to your doctor. Prioritize your well-being. Share this video with a friend. It could save their life. I'm Dr. Susan Hartley. Thank you for joining me. If this helped you, please like, comment, and subscribe for more evidence-based men's health education. You're never too old or too young to take control of your health. Dr. Susan Hartley, on camera. Welcome to part 3 of our series on male genital health. In this episode, we'll explore an often ignored dimension: the emotional, psychological, and social aspects of genital health and how it affects every part of your life. We'll cover mental health and sexual confidence, relationship intimacy and communication, myths that damage self-worth, psychological causes of dysfunction, how to build long-term wellness habits. Let's begin. Mental health-genital health connection. Sexual health isn't just about hormones or blood flow. It's also about what happens in the brain. Stress and anxiety can reduce libido and make erections harder to maintain. Depression often lowers energy and intimacy. Some antidepressants and medications may contribute to dysfunction. Men often don't talk about this. But emotional well-being is a key pillar of sexual wellness. Shame, stigma, and silence. Many men were never taught to talk openly about their bodies. They carry shame, embarrassment, or guilt, especially when things don't work like they used to. But here's the truth. It's okay to talk about it. Doctors are trained for this. You are not alone. Your worth is not defined by performance. The more we normalize these conversations, the healthier we all become. Relationships, intimacy. Communication. Healthy relationships begin with healthy communication. When challenges arise, such as low libido, ED, or discomfort, don't suffer in silence. Talk to your partner. Use we language, not blame. Prioritize emotional connection before physical intimacy. Often, couples grow closer when they face health issues together. Myths that hurt men. Let's bust some dangerous myths. Real men don't have problems. Truth: most men face genital health concerns after 40. If I can't perform, I'm not a man. Truth: masculinity isn't defined by performance. Testosterone therapy is a cure-all. Truth: TRT is a tool, not magic. It comes with risks. Once you lose it, it's gone. Truth: with treatment and care, most men can recover function. Psychological causes of dysfunction. Not all ED is physical. In fact, many young men under 40 have psychogenic ED, caused by performance anxiety, stress, and fear of failure. Negative sexual experiences, porn-induced desensitization, body image concerns. Therapy can help. Mindfulness and CBT are effective. Reducing media overexposure can rewire sensitivity. You are more than your struggles, and you can heal. Lifestyle habits for lifelong sexual wellness. Let's make this practical. Here are 10 daily habits to protect your genital health. 1. Walk 30 minutes daily. 2. Eat whole foods, especially green vegetables. 3. Practice 10 minutes of deep breathing or meditation. 4. Sleep 7-8 hours. 5. Stay hydrated. 6. Avoid processed food and excess sugar. 7. Use natural soaps and avoid tight synthetic underwear. Maintain regular hygiene. 9. Talk about your stress. with a therapist or a friend 10. Get annual checkups, including blood pressure, testosterone, and prostate exams, genital hygiene, infection prevention. Let's get practical again. Hygiene matters. Wash daily with warm water, gently clean under the foreskin, if uncircumcised. Wear breathable cotton underwear. Change out of sweaty clothes promptly. Avoid harsh or fragranced products. Urinate after sex to flush bacteria. Poor hygiene can cause fungal infections, balanitis, inflammation of the glands, odor and discomfort, skin conditions or rashes. Clean doesn't mean scrubbed raw. Be gentle. Final thoughts. Let's talk about it. Health isn't just physical, it's emotional, it's relational. It's about how you feel when you look in the mirror. Your sexual health matters. You deserve information, dignity, and support. And it's never too late to start taking care of yourself. I'm Dr. Susan Hartley, and I hope this series has given you tools, truth, and hope. Subscribe for more male health education, comment below if you have a question, and share this with someone you care about. Together, we're ending the silence, one man at a time. Subscribe to my channel, Still Growing,